Immunizations is a success story for global health and development, saving millions of lives every year. Vaccines prevent diseases that, in their absence, can cause serious health problems, permanent disability, or even death. Welcome to the 8 days of actions for vaccinations. Today, we begin by observing World Polio Day. Polio vaccinations in the Americas is declining, jeopardizing the 30-year gains that have kept our region free of diseases. Let's encourage everyone to get your shots. I'm your host for today, Tanya Macfall Major, and I want you to help me to welcome today's panel. So we'll begin with Dr. Emilia Kane. Dr. Kane, introduce yourself to our audience.
Thank you, Tanya. I'm Dr. Emilia Kane. I'm part of the immunization team at PAHO. It's a pleasure to be today with you, and thank you for joining us.
Thank you so much, Dr. Kane. And we also have joining us Dr. Karen Broom-Toppin. Dr. Broom-Toppin.
Thank you. Good afternoon, Tanya. So wonderful to be here. As you said, I am Karen Broom, and I am the immunization advisor for PAHO. And I support countries in the Caribbean with their immunization programs from as far north as Bermuda all the way down south to Belize, Suriname, and Guyana.
Thank you both for being on our panel, and we're excited to have you here. We know it's going to be informative and with a little bit of entertainment, of course. But we want to encourage persons to share the stream, share the YouTube link, share the information with every and anyone that you can think of. We need to talk about vaccinations and, of course, encouraging persons to not only protect themselves, but to protect those we love. There's a statement that says if vaccination rates continue to fall, we will be left highly vulnerable to the importation and spread of multiple diseases that we had eliminated or greatly reduced through vaccination. Dr. Kane, Dr. Toppin, Brum Toppin, when you hear a statement like that, what comes to mind?
Tanya, if I may.
Please.
So, I guess that the first thing that comes to my mind when you say something like that is the tremendous achievements that we've had in public health through vaccines. I find it incredible, like young people really don't know many of these diseases thanks to vaccines.
Mhm.
And I always find amazing like getting to know people who were not vaccinated and who were affected by these diseases and how they share their stories and always convey the message of, well, if a vaccine had been available, maybe I wouldn't have gotten the disease and I wouldn't have been paralyzed for life, no, for example, with polio. And how
Mhm.
lucky we are to have vaccines that save children from horrible diseases, and really, well, not only children but people from all ages. Now I think that's amazing, and we are very fortunate to have access to vaccines that are safe, effective, and that protect people from horrible diseases, as I said.
Thank you so much, Dr. Amelia. Dr. Brum Toppin, would you like to add to that?
Of course, if I may, I agree so much with Dr. Kane that vaccination has been a victim of its own success. We have done so well, especially in the Caribbean, where we saw really high rates of coverage of polio and measles and diphtheria, all of those childhood vaccinations. And unfortunately, yes, that statement is correct that we are seeing a fall in our coverage. Uh, and it has been exacerbated by the pandemic because we know we had persons who could not get out to clinics. Some vaccination clinics were closed. Some countries were closed. So we really did have it. We saw a definite significant decline during the pandemic, but now is the time to regain those past achievements. And I just think we all just need to work hard to regain what we had before because it's about our children's lives. It is about how can we improve the health and well-being of our children, and then it goes on to our population.
Thank you for that. And I definitely agree with both of you. And so we've heard it time and time again. We're hearing about vaccines, and this question always seemed to ring true no matter the format that we're in. Are vaccines effective and safe?
Let me start by saying vaccines are effective and safe. We've had a long history of using vaccines, of seeing the benefits of vaccines, especially in the Caribbean, where we have eliminated polio, eliminated measles, eliminated rubella. We have a long history of having eliminated these diseases with the use of vaccines. And we have also a long history of having a lot of research done with vaccines. Lots of research has been done. The data is there. And now with technology, it's at a click of your fingertips. You can go and look for the research. Every country has, whether it is the Ministry of Health, whether it is your PAHO office in the country, there are persons, your pediatrician, your doctor, your healthcare provider. There are persons that you can go to and get this evidence. It is there and it's at, it is there for you to read and to look at and for you to discuss with your healthcare provider.
Thank you for that, Dr. Karen Broom Toppin. And I think that it was an important point that you raised about having the conversation with your healthcare provider. It's important that we encourage persons not to seek information from, you know, a person who may not have that much experience in or understand. For example, if I need to know how to fix my car, I'm not going to ask my dentist unless my dentist had experience as a mechanic. And so these are some of the important things that we have to remember as we've had on this infodemic. And so it's really important, again, that for persons who are listening, that you share this important information with your loved ones, co-workers, families, and friends. Tune in, post your question, have your comments. Both Dr. Kane and Dr. Karen Broom Topping are here to help us if you have any questions about anything. And as we go on, Dr. Kane, the question is, if these diseases have been eliminated in the Americas, why are we still vaccinating against them?
Thank you, Tanya. That's a very important question because as we've seen with the COVID-19, the world is totally connected. We're connected, and countries are connected, and people are connected. So it's true that thanks to to vaccines and thanks to the effort of thousands of health workers, we have eliminated important diseases from the region of the Americas. But we have to acknowledge that as long as these diseases are still uh, are still somewhere, wherever in the world, children everywhere are still at risk. So
Mhm.
uh, we we've accomplished elimination in the Americas, but we still have to achieve eradication in the world. So that's eliminating the virus everywhere in the world. And as long as we don't get there, we will still have to vaccinate our children because it's only a matter of someone not being vaccinating, traveling to another country and getting infected and then coming back to our region and spreading the virus, or someone who's infected coming to our region and then spreading the virus. And we know that that's a possibility. We've seen it before. So it's and a very good example of that is what's happening right now in the United States with the polio case, where there's a young person who was infected with the polio and has paralysis because the virus traveled. So as long as people are not vaccinated, viruses are gonna find those people. That's why it's very important to make sure that all children, regardless of where they live, get vaccinated.
I think that you raised an important point, Dr. Kane, when you talked about the virus having the virus can travel from one area to the other. This was something the world saw at the dawn of the COVID-19 pandemic. And these things we cannot take lightly because, yes, travel has increased more. So we have to pay attention to these things. And we must not even take it for granted, as you mentioned, even with our children. We're in different environments now. Things are still, yeah, things are getting back to normal in a sense. However, The virus is getting smarter. It's going to evolve. So it's important that we vaccinate ourselves again to protect ourselves, our children, and our loved ones. And so here's another question. What is polio? We know that today is World Polio Day. We know that there's been significant stride within the region. But as you said, because many persons did not grow up knowing what polio is or seeing polio, we don't know what it is.
Yes,
Dr. Brumtopin? Oh, sorry. Go ahead,
no,
Dr. Kane.
it's okay. No, Karen, please go ahead.
No, go ahead. It's okay. Go ahead, Dr. Kane.
Well, we have to make first a distinction. So we use polio to refer to the disease, which is poliomyelitis, but we
Mhm.
also use polio to refer to the virus, which is the poliovirus. So poliomyelitis is the disease caused by the poliovirus, and it's a very contagious disease that's caused by the poliovirus. And most of the people who get infected, it's are asymptomatic, so they don't have any symptoms related to the virus. But about 5 to 100 people who get infected will have very mild symptoms like a fever, a runny nose, something like that. But then there's some people, it's calculated about 1 to in 200 people who get infected will have a paralytic disease. So that's because the virus will go to the nervous system and destroy nervous cells and will cause paralysis generally of the limbs of the legs, but it can be in other places. And the worst case scenario is that it can cause paralysis of the breathing muscles, and then people can die of polio.
And if I may, I want to I want to emphasize there is no treatment. So when persons contract polio, if there is paralysis, then if that paralysis, sometimes you get it doesn't stay as bad as it is. You get some resolution, but once there's paralysis, that's it. So there's no treatment for polio. So that's why we always encourage vaccination. When we were young, our parents always told us prevention is better than cure. And we've taken that into a whole system of actually putting that into practice, because that is what vaccination is all about. It is about prevention. And prevention is it is better not to get disease, because disease comes with illness, comes with discomfort, comes with pain, comes with all sorts of negative things for the family, for the person, for the community. So if we can prevent that, and we can, then we all should be vaccinated. Children, adolescents, adults, elderly. When we are eligible, we should get vaccinated.
Thank you, Dr. Kane. Thank you, Dr. Brumtopin. Another category that comes to mind would be pregnant women. Should they be concerned about vaccines? We oftentimes hear that, the mother's body is protecting the to be born, the fetus. So should pregnant women be concerned, or once they've received vaccines in the past, the baby is automatically protected?
Right. So the public health nurses in the clinics, the family physicians, the obstetricians are very good at counseling pregnant women. And in that counseling is always a history about what vaccinations have you had. So when you were younger, were you did you get your full course? Did you get your full course of poliovirus? Did you get your full course of tetanus vaccine, of MMR vaccine? Because it
Mhm.
is well known that some illnesses, especially we know a lot about rubella, that if you could get rubella when you're pregnant, that it has some devastating impacts on the infant, on your baby.
Mm.
So for those diseases that we know can cause harm to children, to infants, to babies in utero, definitely we always advise that women, either before they get pregnant, because we know we advise that MMR vaccine from before they get pregnant, or we can also give them the tetanus vaccine during pregnancy so that we know that we will not see any neonatal tetanus. So some vaccines are advised before pregnancy and some can be given during pregnancy. So definitely a lot of counseling within the counseling of pregnancy, of prenatal care.
Mm-hmm.
Yes, vaccination is very, very important in that.
Yeah, if I may add something,
Please do.
uh, I guess that it's important to remember that pregnancy is a state in which our immune system is not functioning to its maximum. So, sorry to say, it's kind of depressed. That's a condition that's normal in pregnancy. So pregnant women are at higher risk for certain diseases, and that's why there are certain vaccines that are especially important during pregnancy, such as influenza, for example. But
Mm-hmm.
what I find, well, I find vaccines amazing regardless, but what I find really amazing about vaccines is that if a pregnant woman gets vaccinated, she gets protected, but also she can protect her baby. So there are when a pregnant woman gets vaccinated, she will give antibodies to the baby, so the baby will get protection as well for certain diseases and for a certain period of time when they can't get their own vaccine. So that's why it's very important, as Dr. Broom said, to go to your health services and make sure that you have all your vaccines according to your age, your sex, and like these particular moments in life, no, like when a woman is pregnant.
Okay, thank you for that, Dr. Both of you doctors. And again, we want to encourage persons to share the link. This is the opportunity. If you have questions regarding vaccinations, do so. And also feel free, even after this stream, to visit any of our websites for any public health topic at www.paho.org/en. And as we go on, other questions, another question came to my mind, Dr. Kane and Dr. Brom Toppin. What about the seniors in our communities? Are there specified vaccines for seniors?
Yes, so as I was saying, we traditionally think of vaccines as for children, but
Mm-hmm.
that's something that we have to change, because really vaccines are important throughout the entire life course, and there are special vaccines for children, as we know, but there
Mm-hmm.
are also important vaccines for the elderly. So the elderly should also go to their health services and make sure that they are vaccinated. As I said before, in pregnant women, when I explained that their immune system is not working as to its maximum, that's
Mm-hmm.
also the case for the elderly. As we grow up, our immune system tends to function less efficiently. So it is very important for the elderly to get their vaccines. And one very good example is the COVID vaccine, which we all know that the elderly are a priority for this vaccine. And elder people should make sure that they have a complete schedule for COVID and for other vaccines that are available for them.
Thank you so much, Dr. Kane. So, what should people do to prevent polio from returning to their communities?
There is one most important thing. Make sure that you have had all of your polio vaccines. Make sure your children have had all of their polio vaccines. Because if we all are vaccinated, then what's the virus going to do? There's no one to infect, and there's no one to cause harm.
Mm-hmm.
So vaccination is extremely important, and that is the highest priority for those for those in terms of us preventing getting uh, polio from reestablishing in countries that have eliminated it.
Right.
and also from persons getting ill. In terms of our health systems, it is important that healthcare workers be on the lookout for anyone who has what we call acute flaccid paralysis, which
Mm,
is really paralysis where your limbs are very loose, right? There's no tension in the limbs. So
wow.
if persons go to our emergency rooms, go to our health centers, go to our hospitals with what we call acute flaccid paralysis, that we investigate, so that if by chance it may be polio, that we would find it quickly and be able to do our investigations and controls. So those are the two important things: get vaccinated, and for our healthcare workers to ensure that they investigate all cases of acute flaccid paralysis.
Thank you so much, Dr. Brimtoppin. So, Dr. Kane, as an adult, should I continue to receive vaccines? And if so, which ones?
Yes. So I guess that the best answer to that question is that you should, as an adult, you should go to your health services and to your medical provider and talk with them about your age, your risks. So if, for example, your if you're exposed to certain things because of your job, for example, so
Mm-hmm.
in that way you can check your vaccination schedule and make sure that you have all the vaccines that are recommended in your country for your age.
Yes. And I'm going to jump in here. I say to persons all the time, that vaccine card or that immunization booklet is
Mm-hmm.
so important. And I know some people think that, oh, when I become an adult, a lot of people can't find them.
Yes.
And it is so important that you have that record. What did I get as a child? What didn't I get? What do I still need? So I want persons to protect that vaccination card, put it in a lovely plastic sleeve so that it can't get wet, it can't get marked, so that it is in good condition. And parents, protect the children's vaccination booklet. Keep it in a safe, dry place. And I know that we always say, especially in the tropics, you never know when a hurricane or we're going to have lots of rain. Put it with your important documents, the same
Right.
place you have all of your insurance policies and your important financial documents. The green card or the vaccination card should go there as well, because it is just as important.
You're right. As we were always taught, you're supposed to have a to-go bag. And you should
Yes.
always have all of your important, just as you have your passport or other government ID. You need to ensure that you have your vaccine card in your to go in your together, so you can put it in your to go bag in the case of an emergency. But I have a question for you, panel. Going back to the community, if it is discovered that a person has, for example, polio, a person is suspected to have polio, what then should members of the community do? Should they all go to get tested? Should they all go to get vaccinated? What should happen in that regard?
So I guess that the first thing is that the person who's thinking about, or the person who's having the paralysis, the acute flaccid weakness, as Dr. Karen explained, should
Hmm.
go and to the health services and seek attention. And all the countries in the Caribbean a have a surveillance system that will investigate this case and determine if this paralysis is due to polio or to other things. Because it's important to say that there are other things that cause this acute flaccid paralysis. It's not always polio. So if if polio is confirmed, then the health authorities will have a plan on how to assess the case and respond to the case.
Hmm.
And so the most important thing will be, again, to know your vaccination status and be up to date with your vaccines. But we don't have to wait for that to happen. No, we don't want to wait for that to happen. So the best thing is to be prepared for that, and as Dr. Broom was saying, to prevent that from happening, and make sure that everyone has a complete vaccination schedule so that we don't have that scenario. But if that scenario happened, then we should know that our countries are prepared to respond, and that the response will be by vaccinating.
Mm. Thank you so much for that, Dr. Kane. Where can we go to get vaccinated in our communities?
Depending on your community, there may be many, many places where you can go.
Okay.
And I wanted to follow on because this follows on nicely from what Dr. Kane was saying. If you have any any concern about whether you've had your vaccination,
Hmm.
then take your vaccination booklet, take your vaccination card, and go to your healthcare provider because they can look and they can say, yes, you've had all of your vaccines, you don't require any more, or no, or there you seem to have missed. In many countries, whether it be government health facilities, pediatricians, GPs, your healthcare provider can direct you to where you can get a vaccination if you're unsure. Others, they say that if we know where the vaccination centers are, you can
Right.
call. You don't even have to go to your health center. You can call and they will tell you if it is a specific one, yes, today, or not today, come tomorrow. Or
Mm.
you make an appointment. So calling or going to your healthcare provider or your health center is a great way to get vaccinated.
Thank you for that. And one of our final questions, do vaccinations have a cost?
In many countries, vaccination is free of cost. So you can go to your healthcare provider and it is free of cost. In some countries, if you go into the private sector, you pay for your visit, or you may pay, for peripherals. But vaccination is free of cost in the countries. So it's just a matter of finding out where you can go, and it's usually a government vaccination site that you can go and get it free of cost. Some
Right.
countries have private vaccination sites. So their pediatricians and their GPs are involved in the national immunization program, and they also will administer vaccines free of cost. So again, if you're unsure, call your healthcare provider. You can call the Ministry of Health. They can tell you where to go to receive it. But there always are many resources, and we need to take advantage of them so that we can get ourselves vaccinated and protected.
Thank you so much, Dr. Karen Broom Toppin. And as we prepare to wrap up this afternoon session, again, we want to reiterate, we want to encourage persons, get vaccinated, get your shots. Our hashtag for this year is get all your shots. We want to again to protect our loved ones, we want to protect ourselves, and to protect the community at large. Another important group that we always want to remember during COVID 19, the prime of COVID 19, we always remember to say to protect those that cannot get the vaccine themselves. So we also need to bear all of our brothers and sisters in mind, despite their background, despite their capability levels. We're not doing it just for us. We're literally protecting our entire community. Vaccines are free. Check out your local healthcare provider. Get all the vaccines that you need to ensure that you are safe. And so, again, I want to say a special thank you to our panel. And just before we conclude officially, I would like to start with Dr. Kane and then followed by Dr. Karen Brumtoppin. We would want for you at this time to give your challenge to your call of action. We're all about actions in our 8 day of actions for vaccination. We want you to put a challenge out there, do a call to action for those persons that are interested in vaccinations. Dr. Kane?
Thank you, Tanya. So I guess that the first thing that people, or I invite people to do, is like to look for their vaccination cards and their loved ones, their
Hmm.
children, and make sure that they have all the shots they need. So that's the first thing that they should do. So after that, if they see that they need any additional shot, just go get your shots. Go get your vaccines. Make sure you're up to date. Make sure your children are up to date. And and maybe like after that you can get some information from good resources. So PAHO is a great source of information. There's lots of information in PAHO's website, but you can also go to WHO's webpage or your Ministry of Health webpage and get information about vaccines. So find something that you didn't know about vaccines and communicate that to others. Make sure that if you've participated in this live or you've heard the information that has been shared today, to share something out. And that's also something that we can do as a community to ensure that people know about vaccines and know about the benefits of vaccination, and make sure that everyone is vaccinated and that we're protecting everyone in our community. And the last thing, for this challenge that you're proposing, is that we don't only take these 8 days of action for vaccination, but that we really commit to sustaining our achievements in vaccination. So these 8 days for vaccination are a great start point, and it's something that should really be used to encourage vaccination and to regain the like to regain what we're missing and these declining coverages. But vaccination should be done every day, every single day, and
Right.
received by every single person. So this should be only our start point as we move forward. Yeah,
Thank you
thank
so
you.
much, Dr. Kane. We do appreciate it. And Dr. Broom topping?
Well, since Dr. Kane has really covered all the bases with the public,
She did
I'm going
such
to,
a good job.
yes, she did. I'm going to talk to the healthcare workers.
All
And
right.
I'm going to say, we need to find every last child. We need to find those children who have never been vaccinated, who have had some of their vaccines, but not all. And if we find every last child, it will be a job well done because we would have protected our families, our communities, our country, and our region.
Thank you so much, Dr. Karen Brom-Toppin, Dr. Amelia Kane. And again, we want to say to our audience, thank you for participating today. Share the stream. Go back and listen to it if you need to. The information is here, and we're here to assist you along the way as we want to ensure health is available, giving access to everyone, everywhere. And as we're celebrating our 120th anniversary here at PAHO, we would continue to our mandate, serving each and every person. And we want to say a special thank you to our tech team, who's always in the background, ensuring that everything goes smoothly. We could not do this without you. Have a great day, everyone. And do remember to get your shots. Have a great day.